because we come from communities where the truth doesn't always reach the headlines, but it lives in what we face every day. This is Changing Trends and Times, bringing clarity and context to the issues shaping our lives right now. No spin, no distractions, just real talk rooted in real impact. Now, are you ready to lean in and bring your voices into the conversation? Then, allow me to introduce to you a man committed to asking the questions that matter and breaking it down so we all understand. Your host, Charles King.
Good afternoon, ladies and gentlemen, and welcome to Changing Trends and Times. I want to start out by giving you guys a series recap. This is the final installment of the Changing Trends and Times four-part series, Healthcare and the Underserved Communities. In part one, we diagnosed the problem, the history of medical racism, and the state of healthcare disparities. In part two, we confronted the mental health crisis. In part three, we mapped the architecture of systemic barriers. Now here in part four, we do what this show always does in the end, we build. We examine what solutions exist, who is already fighting, and what all of us as individuals, communities, advocates, and citizens can do to dismantle the wall and reclaim health as a right. Healthcare is a right, that is. So what I want to do first is I want to start first with a Black history reflection before I go on to give you guys a synopsis of today's show, as well as introduce and bring in our expert analysts. So what we're going this Black history reflection that I'm about to do is called Building What They Were Denied, the Black medical tradition of self-determination. There's a tradition in Black America that the history books do not always name clearly, but that they are every generation of this community has lived and understood in the marrow of their bones. When the door is closed, you build your own house. It starts, as so many things do, with one extraordinary human being who refused to accept the world as he found it. Dr. Daniel Hale Williams was born in 1856 in Hollidaysburg, Pennsylvania, the son of a barber and a woman of mixed Black and Native American descent. He trained as a physician in the era when Black doctors were curiosities that white medical institutions actively worked to erase. He could not practice surgery at Chicago's major hospitals. He could not join the city's established medical societies. And so in 1891, he did something that would echo through history. He founded Provident Hospital, the first non-segregated hospital in the United States and the first hospital in America with an interracial staff. He did not petition for a seat at the operating table. He built the operating table. And then in 1893, he performed one of the world's first successful open heart surgeries, repairing a torn pericardium on a laborer named James Cornish, without antiseptics, without modern tools, with steady hands and absolute resolve. Dr. Daniel Hale Williams is not just a Black hero, he is an American hero, and his story is not the exception to this tradition, it is the prototype. In the years immediately following Civil War, millions of formerly enslaved Black Americans were liberated into a country that offered them freedom in name, but continued to shut them out of every institution designed to support human life, including medicine. The Freedmen's Bureau, established in 1865, responded to creating hospitals specifically to serve this population. These Freedmen's Bureau's hospitals were imperfect, underfunded, and ultimately short-lived, but they were something profound. An early model of community-centered healthcare for people who had been systemically denied access to care, they proved that when the government chose to act, when there was political will, health systems could be built to serve those the dominant system had abandoned. They're among the earliest blueprints we have. Howard University College of Medicine, founded in 1868, and Meharry Medical College, founded in 1876, were born for a singular and urgent reason. Black students were barred from attending predominantly white medical schools, full stop, so Black educators, philanthropists, and communities built their own. Howard and Meharry together produced an overwhelming majority of Black physicians in America for decades. At one point, more than 85% of all Black doctors in the United States had trained at one of these two institutions. Today, they remain pillars of Black medical education, training not only physicians, but dentists, pharmacists, nurses, and public health leaders. They're not remedial institutions, they are foundational ones. And every life saved by a Black physician in America traces its roots in some form back to what those institutions built when exclusion seemed total. Born out of the war on poverty and the urgency of civil rights movement, federally qualified health centers, FQHCs, were designed in the 1960s with a radical premise that healthcare is a right, not a privilege, and that centers serving low-income and underserved communities would be located in those communities, governed by those communities, and funded to serve regardless of ability to pay. Today, more than 1,400 FQHCs serve over 30 million patients annually across the United States in rural counties, urban neighborhoods, and tribal lands that no private health system has ever chosen to serve. They are the living legacy of every community that refused to wait for a broken system to fix itself. The through line across all of these stories, from Dr. Williams operating by candlelight in 1893 to community health center opening its doors in rural Mississippi in 2024, is this: every generation of underserved Americans has faced exclusion, and every generation has responded by building. That tradition of self-determined institution building is not a workaround. It is a consolidation, it is a consolation prize. It is a blueprint. It is how we have always won, and it is how together we will win again. So as we get ready to get into this, let me tell you guys this part as I introduce our special guest. Change is possible because change has already happened. Community health centers exist and they serve 30 million people. Black medical schools train doctors who practice where others will not go. Advocates have won Medicaid expansion in states where legislators refuse to act by taking it directly to the voters and winning. Real solutions are not theoretical. They are already in motion. They just need more fuel, more funding, and more political will. More of us showing up informed, organized, and unwilling to accept the world as it is when we know what it could be. In this final episode, we're going to look at what is working, what we can demand, and most importantly, what each of us can do right now. Today, with what we already know and the community we already have. This final episode is not a bow on a box. It is a blueprint. With this blueprint, I have an expert analyst that's going to be here with us to help us today. And his name is Mr. Ernest Jefferson Jr. Mr. Jefferson Ernest is going to tell us as we get into this about this in this final episode, as to his lived experience, his work as an advocate, as well as a caregiver, and the work that he does also to help when it comes to policy advisement. Ladies and gentlemen, I want to introduce you all to Mr. Ernest Jefferson Jr. Welcome to the show, sir.
Thank you, Mr. King. I appreciate you, and it's a pleasure to be a guest on this very informative show dealing with a pertinent topic that impacts all of us.
Yes, sir. And so before we get into the show, can you please tell our audience a little bit about you, the work that you're doing, and the importance of what it is to serve people that need your help?
Absolutely. So, by profession, I am an operations manager. I've been in the business field all of my career. But one of the things that I do, I serve a lot in civic organizations and in ministry. And one of the things that I have noticed in my community was that it was very important that we pay attention and give attention to the disparities that we have in the communities. I would. You still have me, Mr. Key? Okay.
Yes, sir. You're here. I'm sorry. That was me.
Yeah, you're good. You're good. I want to make sure we didn't have any technical difficulties. One of the things that I did early on is that one of the major hospital systems here, and I live in Greenville, South Carolina. So one of the major hospital systems in the county start sponsoring an annual minority health forum, which I thought was awesome because they recognize the need to give attention, special attention to the needs of those in our community who could have be overlooked. And Charles, there are several reasons to that. I mean, there are a lot of reasons to healthcare barriers. There could be money issues, not enough doctors, travel limits, social factors like poor housing, language and culture barriers. And so I became a volunteer because I thought this was just an awesome way that I could give back to my community, but also, support what this major medical system was doing. Years later, in 2016, my maternal grandmother got to the point where she needed a caregiver. And so I took on the role of being the lead caregiver for her. That meant that I had to, and she was in her 90s at the time, and that meant, Charles, that I had to take her to her medical appointments, that I had to oversee her household, that I had to look at the medicines that she was taking. When she would go to the hospital, I had to deal with her doctors and her medical team. And so I had to educate myself on a lot of the things that she was dealing with, because while my grandmother was very sharp in her 90s, there were a lot of things that, I even had to brush up on and make sure that I understood. So it was very important. She had, and so I learned the importance of advocacy, serving as her caregiver. And finally, Charles, last year, personally, I was diagnosed with prostate cancer. And so as I have been over this next year, as I've been dealing with my own health crisis, even more have I been in tune with the importance of understanding the need for healthcare, but also taking on the mantle of being an advocate for other men who are dealing with prostate cancer and helping spread awareness. And even in doing that, we see, while we have some systemic issues that are prevalent in our communities, and I've tried to join other organizations that would help me, help kind of navigate those issues.
So, what's important. I love the work that you're doing, and I want to thank you for the work that you're doing because it's definitely needed. But let's start with talking about the community health workers because, being trusted messengers, that is that's in the gap. It says that community health workers are trained members of the community who serve as bridges between clinical healthcare systems and the communities they were born into, they live in, and they belong to. When we think about that, can you tell us how often well, just say community health workers are often described as trusted messengers? Why is the trust such a critical factor in healthcare delivery?
Yeah, so when you think about how crucial our health is, I mean, we often hear the term that health is wealth. And that is so true and very, it's a fact. Because if you don't have good health, you are not able to enjoy life to the fullest. And so when it comes to having community workers, you have got to, as in any relationship, trust is a key component in any relationship. So when you say that you are a community health worker where you are representing the community, and that should be all members of the community, not just a segment of our community or a segment of the population, but you should be concerned about all. There has to be a level of trust, because trust is a key factor in any relationship. Because if I don't trust you, I'm not going to be truthful with you. I'm not going to be able to disclose everything that's going on. And so it is very important to establish that level of trust and confidence in a health care situation.
So, can you tell us, how do community health workers bridge cultural, social, and communication gaps that traditional providers struggle with?
Yeah, so one of the things that I see, even when I was caring for my grandmother, we had to enlist the assistance of home healthcare workers. And that is an ideal situation that's set up where you have these health workers who enter the home. And of course, there definitely has to be a level of trust there, Charles, to have these complete strangers to come into your home to care for your beloved family member. But I think one of the things that I like about this system, because typically you are approved for, your insurance will approve you for a set number of hours for each week. And so as these community health workers are coming into your home or the home of your loved one, they are developing this relationship. But that relationship means that you are sharing, you're understanding the needs, you're understanding what's important to that person. And because they are with the person every day, unlike some family members, even they're able to relay certain aspects about their care, about the needs, things that they notice that could get overlooked. So I think it's very important that they come in, that they understand they're developing that rapport, but they understand some of their needs that individuals may need in the community.
So, in your community work, where have you seen community health workers make the biggest difference?
Yeah, so I think it's any level. Again, like I said, you have the home healthcare workers who I think are crucial. You also, in South Carolina, we have a system set up called South Carolina House Calls, where again, train nurses and practitioners who can come into the home instead of in my grandmother's case, she was to the point where it was a chore to get her dressed and loaded up and try to get her to an appointment. We had it set up where through house calls, the trained medical providers could come into the home and administer care. Also, we have organizations, since I have been diagnosed with cancer, one of the things I wanted to do was to become an advocate and help spread awareness for others who are going through cancer. So there's one organization called the Neighborhood Cancer Connection, where they provide financial assistance, they provide resources, they provide just a safe haven workshops to educate the community. But one of the things, a lot of times people are not aware. So one of the things that I do as a community advocate with them is that I go on social media, try to spread awareness. We just hosted a community workshop not too long ago. So it's about, getting into our community and spreading the word and letting people know and understand what resources are available. Because if people don't understand or don't know what's available, then a lot of times, it doesn't benefit anyone. And then also my own support group through Zero Prostate Cancer. Again, this is an organization that I joined last year once I was going through cancer personally, because I understood the importance of having a community, having a network of other individuals who could support you, who could be there for you. And so the leadership of that organization not only provides in-person groups, but they provide virtual groups as well. And so they help support individuals who are going through cancer. So I think there are a lot of examples like this within our communities, but a lot of times we don't know it, we don't understand. And a lot of times, Charles, there are not a lot of people who look like me who are attend these events. Like, for example, in my cancer support group, I regularly attends this group, and I've been going for a year. Yet, when you look at the numbers in our community, it's disproportionately, we have men of color who are impacted by prostate cancer. So this shows you the need to have these organizations.
So what skills or qualities make a community healthcare worker truly effective in underserved communities?
So first and foremost, you have to understand the community. You can't live in one area and then come in and try to legislate policies and procedures. You need to understand the community. It would be helpful if you live there, but even if you don't live there, you need to have a grassroots effort where you have genuine concern, you have a heart and a passion to serve, that you are listening, that you have empathy and sympathy about what's going on within the community. And I think even if you don't live in the community, if you come with a heart to serve, if you have empathy and sympathy, then you can be quite effective and well received as well.
So let's talk a little bit about diversifying the medical workforce and the training and what the training providers who look like their patients. It says the research is not ambiguous. Patients receive better, more culturally responsive care from providers who share their cultural background and are less likely to carry the implicit biases that research has documented throughout the medical profession. Black patients are more likely to adhere to treatment plans from Black physicians. When we think about that in the diversification, and we know of things that have historically happened to people in the Black community, when we talk about the medical field, first thing everybody talks to and points to is the Tuskegee experiment. And so with that, can you tell us, why does representation in the medical workforce matter so deeply for patient outcomes?
So let me first talk about my own experience. So my primary care physician is a Black man, and that is by intention and by design. While I know and respect all members of the healthcare community are trained, and they have taken an oath to help and serve the community, it was very important for me to find a Black man in particular who could with things that I'm going through as a Black man. I think otherwise it would be very difficult to understand that. And the relationship that he and I have is a great relationship. We have a great rapport with each other. I can come in, I don't feel ashamed or bashful to disclose anything that's going on with me. One of the things I love about it is that he's concerned, but he shows tough love. I love how he, as I'm been navigating this cancer journey, he is also mindful of how cancer impacts our, people of color in our community. And even when it comes down to different medicines that I take, or over-the-counter meds that I take, he is very mindful of how, our bodies may react to certain things. So he, by virtue of being another Black man, has earned my total respect. And I feel so at ease, talking with him, disclosing anything to him. So going on to say, I think it's almost, it's almost like you need individuals of color to represent and be in their community, to serve their communities. There are a lot of things, Charles, that can go into that we can say why we don't see more. I mean, it could be barriers to education, or it could just be simply because they have not seen a lot, because a lot of times you hear the motto, what they see is what they'll be. A lot of times you may not see them in the community. And one of the things that I like about my community, a lot of the physicians of color, they often participate in healthcare forums that we have in our community. They have workshops they partner with different churches and have workshops. And I think when the community see them, especially our children see them, and teenagers and young adults see them, I think that is an inspiration within itself to say, yes, I can be like this person. And so that gives them something to aspire to. But like I said, even as it relates to my own healthcare, I just feel more at ease, and I can relate better to a Black man who is advising me, who is overseeing my healthcare. And even when he gives me that, I get as mad at him because I know he has my best interest at heart.
And look, I got to tell you that is more refreshing than anything. And again, it's not anything against anybody else, but I will tell you that there's a comfortability factor because I myself, in wanting to have that same situation and that same experience that you're having, it's like to go out and to find those, it seems like it is so hard to find that physician,
Yes.
Yes.
But
it would make me feel so much better, just like you're feeling.
Yeah, and Charles, one of the things I want to add to that too, a lot of times over the years, when we have discussed, if we, look at something and he needs to refer me to a specialist, he knows that I would prefer to be referred to a specialist that looks like me. So we are very aware of that. So, a lot of times that means because he's in one hospital system and he has referred me to specialists in other hospital systems that he's aware of. And so we just kind of have to network within our community. And again, like you say, it's not throwing shade. It's not saying that the other providers are not capable, that they're not competent. Again, it's just I feel more at ease with someone who looks like me handling my health care and managing my health care. And so that's just something, because one of the things that I'll say, Charles, is that you're your own best advocate. And so you have to make this best for you. And so for me, that is best for me to not only have a primary care doctor, but when I can, even be referred to a specialist that looks like me. But like you said, sometimes that can be challenging to find.
So can you tell us, how does seeing a provider who looks like you or understands your lived experiences change the patient-provider relationship?
Yeah, I personally, I think it just makes you open up more because I am, by nature, I am a person, when I meet someone new, I will have a lot of walls up, and it would take some time for those walls to come down. So, in particular, as it relates to your healthcare, you're talking about some of the most intimate things that you would ever talk about with anybody. But, because my primary care doctor is a Black man, I can talk to him about anything. Sometimes probably TMI, but we are able to talk about we're able to talk about anything that's going on with me, and I don't feel that I have to talk around something. I just straight tell him, this is what's going on. What are your thoughts about it? And even as I've been navigating my cancer journey, even though I'm working with another cancer specialist, he is still in tune with what's going on. So he reviews the notes in my chart, and he is giving me his thoughts and his professional opinion about what my cancer specialist is telling me. So it's almost like having a big brother almost that's watching out for you and looking out for your health and your best interest. And so it's just very much refreshing and appreciated.
So what barriers still prevent Black and brown students from entering medical and health professions?
Yeah, so I think some of the barriers could be, again, maybe they have never been exposed to a physician, and so they may not know that one exists or that they can be. Again, what they see is what they'll be. So maybe it's have not even seen a doctor of color. That could be one thing. The other thing, of course, we know that there's extensive educational training that is involved. So you have to, go to school for quite a while. It's quite extensive. So, it could be that, financially, looking at that, people may say, well, I don't want to go in, that much debt. But sometimes you have to sacrifice, for a career that would be long-standing. So that could be another thing. But I think if you make up your mind, you want to do that. Of course, there are scholarships available. You just have to do the legwork. And one of the things that I think could help, Charles, is that if these established physicians of color would get out in the communities, get into the churches, and have almost a career fair almost for our high school students, our college students, to kind of help them to navigate if this is the path that they want to go in the medical profession. Whether that's nursing, some type of technician, some type of physician. I think that would greatly help them to navigate that and kind of ease, some of the intimidations that they may feel, getting into that field.
So, how can communities, churches, and civic groups support young people pursuing healthcare careers?
Yeah, so I think, again, we need to make sure that we allow individuals to pursue their dreams. Mm-hmm. Nothing is off limits. And I think we need to let people aspire and dream big, because you never know, what this young person is capable of. Our young people are so impressive. They have so many skills and talent and a lot of untapped potential. And I think we need to just encourage them. We need to start young and start, saying, what are your interests? And if they mention that they are interested in the medical field, let's start at getting them some mentors. Let's bring in doctors and nurses and technicians who are already working in the medical field. Let's bring them in and let them mentor them and help them navigate and let them know, if this is the path you're going to take, is first of all, it's doable, and this is how you do it. It always helps when you have someone who's established, who has already arrived, can reach back and help those who are coming along in the community. So I think our churches or nonprofit organizations and others can greatly help in making sure that they can just recruit some mentors and help to, encourage and coach our young people who want to go into the medical profession.
So, if you could redesign the pipeline for training diverse providers, what would you change first?
So I think we need to make sure that individuals who work in this field go through some type of sensitivity training where they don't come in with these preconceived stereotypes. I think that's one of the worst things that you can do, is to stereotype in the community. So I think you need to make sure that they have had the training where they understand that also you need to listen more than you come in with solutions. You need to listen, and not listen to respond, but listen, genuinely listen to what that person is saying. Because after all, these individuals who live in these communities, they know their bodies better than anybody else. They know their neighborhoods and the plights of their community more than anyone else. So we, they need to listen. So I think training that help them to listen more, and to, once they have gathered that information from the community, then let's come to the table and let's start working on solutions that would help benefit that community and what has been presented.
Yeah, what you just said is something that that popped up in my head. Where I remember I was talking to just a great compatriot of mine, and in just talking, this was a while ago, and the conversation we were having, in just talking about just healthcare for some strange reason, but he said to me, he said that he told the doctor he was feeling this way and some things that he thought was going on. And he said the doctor told him, no, this is what you're feeling. And,
Yeah.
I was taken by that because I'm like, how do you tell me how I feel? Which means you're not actually acknowledging me as not just as a patient, but you're not listening to what I'm telling you, what my experience is.
True.
And so this is the thing. I think when we go back to the cultural issue, when we look for providers to actually help us out, that plays a major part in that. And this is why a lot of times we just do not want to deal with folk that don't look like us.
True. And Charles, so that is so key, because one of the things that I have noticed, even when I was a caregiver for my grandmother, and even in my own healthcare, when a lot of times when you are advising and telling them what's going on with you, then I get it. In the world of modern technology, they are typing in what you are putting, what you are saying, and then they are using AI, whatever, and letting that diagnose what they think it is. And a lot of times, while AI and technology is great, sometimes the responses that they get is not what you are going through. So I think you really have to speak up, and we have to learn how to have a voice in our own healthcare, because if we hear something that we think is not right, we need to speak up and say, hey, I don't think that's quite what I was trying to relay. And my grandmother was excellent at this, even in her 90s. And my grandmother, of course, never used a computer in her life, but and I would be in her doctor's appointments, and I would just kind of sit in the background listening to the conversation, because my grandmother could hold her own. But if I felt that they were trying to, where I had to intervene, then I would certainly intervene. But she held her own pretty good. So I was always, I took a lot of notes from her.
So that look, that's what grandmothers are for. I will tell you that, because my grandmother was like that too. Let's talk a little bit about the policy advocacy and what every citizen can do. According to our some findings that I found in doing this research, it says that healthcare access is determined by policy. Policy is determined by political will, and political will is determined by civic engagement, yours. Every person watching this episode has the power to take concrete, meaningful action right now. Know this episode has the power to take concrete, meaningful action right now. Know your state's Medicaid expansion status if it has not expanded. Know who is blocking it and why. So when we go back and we say that, and we know that according to the Affordable Health Care Act, every state was supposed to be a part of the expansion program, but it was systemically the issue of in the region in which you and I reside, that none of these states did the Medicaid expansion, which means that our tax dollars still went into the pool, but we couldn't afford, we weren't able to get that access that we were paying for. But all the other states outside of this region were benefiting from our dollars, and their folk didn't have to pay that much money when it came down to, and still when it comes down to their health care. Now, as we think about that, and we know pretty much how that is now, and now a lot of these governors may be trying to change that. Many people feel policy is too big for them to influence. How do you break that mindset?
So, it's almost like a person saying that their vote doesn't count. And we have fought that battle where we know that when our people were disenfranchised from voting and what we had to go through to even get the right to vote. I would say you start at the smallest level. You start at the grassroots level. You start with your local town council. You start with your state government, and then understand who your representatives are, and whatever policies that are not benefiting your community, your state, make that known. I mean, you can attend your local town council meetings if there's something that's going on in the community that you think can help. For the state government, you need to understand who your state representatives are, make them aware. But also, we need to be mindful of who we're putting in office. I mean, when it comes time to vote, you need to understand where they stand on healthcare issues, and understand who you're voting for, and make that count. And even if the person you voted for doesn't get in office, the person who is an elected official, they are supposed to be rep people. And so if the people have concerns over healthcare, then that has to be addressed, but you have to make that known. But I know, when you get into the political system, it can be taxing and overwhelming, but I said you can start at just the local level. But I think you can't lose your voice, and you have to make sure that you try to make sure that your voice is heard.
So, what are simple, practical steps everyday citizens can take to advocate for healthcare equity?
Yeah, so there are several, Charles. I'm glad you asked that. So one of the things I think that every citizen should look in their own family. They should look in their own community and see who is being underserved. And I think that every citizen has the potential or the ability to serve as an advocate or a caregiver, or see what they can do just to help their neighbor or help somebody in their family. Another thing that is important, every citizen needs to learn how to read these EOBs, explanation of benefits, because you would be surprised about the erroneous charges that are placed in these benefits. And if you're reading this, and I remember I was reading one of my grandmother's EOBs, and I was like, she didn't get this. I was like, why are they charging us for this? And it might not be charged us, but there's an insurance company. So I would get on the phone with them and say, hey, this is wrong. This is bad information. But that's something that every person could do. We need to understand our workplace benefits. When I was diagnosed with cancer last year, one of the first things that I did, I had a conversation with the benefits team on my job. I was like, hey, I've been diagnosed with prostate cancer. I need to know, what are my benefits? What is available to me to assist me? And the benefits team sent me an email with all of these attachments, all of these numbers, and they broke it down. You go to this group for this, you go to this group for that. And I was like, and I was so thankful, for them for giving me that information, but I had to ask them that information. Also, if you have benefits in the private sector, you can do the same thing. I think also you can volunteer. You can volunteer at a local hospital, or you can volunteer at a community forum. Or if you think something is lacking in your community, talk to your local pastor, talk to a local representative, and see what you can get to bring awareness in your community. I think also, and I think this is very important, and a lot of times it goes unnoticed, but we need to make sure that people in our family understand our healthcare wishes. So ideally, you would have some type of healthcare directive or POA, but that's very important, because when it comes down to making life and death decisions about you, you want to make sure that your wishes are being carried out and not somebody else's for your life. You can also attach it in your community. It just see a need. This help meet that need. Nothing is too small. If somebody, you feel this needs a ride to the doctor, that is huge. And then, like I said, churches play a vital role. Our churches have always been a crucial place in our communities where we can go, that we could not only be inspired and edified, but also they help. They help host and have forums and trainings and other stuff. So I think our churches need to continue that effort. And then I think we just need to network. I think it's so important that we network, that we help educate each other, that we, if we know about something that's going on, then we help spread the word to others. So I think there's just several things that we can do as everyday citizens.
Ernest, I think for some of the pointers and suggestions that you made that stick out more so than anything is what people can do in the community, but also when you were talking about the EOBs. Mm-hmm. When we get some of our people that work at particular jobs where benefits can be a little bit better than some other places, but can you speak to this as to, like when some people actually misunderstand the things that they select when they have open enrollment, and they select something that could really, really work for them, but they don't know what they have really selected. Tell us about how they can get a little bit better when it comes to that, because there's a lot of coverage that a lot of people have that totally goes unused.
So true, and that's key. I think if you look at Medicare, for example, typically before you have to do enrollments in Medicare, there are typically numerous centers in our community. I know in my community, there are numerous centers that host Medicare workshops where they are explaining this information. A lot of you go to these workshops, you just see a handful of people there. But you have an ideal, time in a situation where you can go and educate yourself, and they can help you, make these selections and help you understand. Same thing for those of us who are employed. I know every year before we enroll in our benefits, we have numerous opportunities to virtually log in, understand the different benefits that we choose, understand what they mean, what they cost, how much is being deducted from our paychecks, which is important, but understand, what it means. And so I think if we attend, these workshops that are available to us, then I think that will help us make better informed decisions. But we have to put forth that effort as well. I mean, but yeah, we shouldn't just blindly go checking boxes and not knowing what we're getting ourselves into.
Can you tell us how can the faith communities and civic organizations mobilize people around policy issues without becoming partisan?
Yeah, so I think they have done it for years. I think our local pastors and a lot of times, even in our congregations, we have individuals who are members of the medical community already. So I think they help bring awareness. They can help bring advocacy. They can, they can kind of help build a bridge between those in the medical community and those within our actual community that we live in. So I think they can. I think there are ways to do that. I think our faith communities are crucial. I think over the years, traditionally we have look to them to help us navigate through many things, political and otherwise. And I think healthcare is no different than that. So I think just giving us the forum to discuss these issues and bring in others who are making decisions. And a lot of times, these politicians, they are quick to come to our churches when it's time to vote. But we also need these same politicians to come to our communities when it's time to deal with some of these issues that we're going through as well.
I know that's right. So, what role does storytelling, sharing lived experiences, play in shaping policy?
Yeah. So I think when those who are in position, who have been voted in position to make the policies, I think they need to understand the real stories in our communities. I think sometimes some of these individuals, some, not all, but some can be so far removed that they don't truly understand. And I think they are exposed to the real life decisions that people are making about healthcare, the challenges, understanding the real life challenges that people are having about healthcare, understanding the barriers that they are understanding about healthcare. I would like to think that the humanity in them would prompt them to make policies that would help better serve our communities. But I think it's about having that. You have to have that awareness, and again, be very aware of who we're putting in office. That's why every vote is important, and we just should not, neglect our duty to vote as citizens. I think we need to be mindful of who we're putting in office, and once individuals are in office, we as the public, we can hold them accountable and demand that they meet the needs of the community, of their constituents.
So, if someone wants to start advocating today, what is the first step you recommend?
If they were to start advocating today, the first thing I would say, because the healthcare field is so broad, Charles, there's so many things. I would say find a niche in the healthcare field. My niche right now is cancer because I am personally impacted by cancer. And so I have a passion and a zeal to advocate for other cancer patients, to help bring awareness in my community. So I think any person who wants to be an advocate is wonderful, but I think they need to find their passion, find their niche. What has impacted them or their family? What is going to give them that passion to stick with this for the long term? So I think that's the first thing that they need to understand and do.
Well, I definitely want to thank you for being here because I got a short while here, so I'm gonna get ready to close out the show. Can you stick around for a few minutes, or do you have to leave now?
I can stick around.
Okay. Well, let me. I'm gonna get ready. I'm gonna go ahead and close the show. For all of you that have been watching, I want to thank you for taking the time to be here and to learn from some of the great knowledge that Ernest has just dropped with us, because as you clearly see, not only is healthcare right, but the thing is, there are some communities that are actually doing their jobs with their due diligence by paying into systems, paying taxes, doing what's necessary, but are the people that are not able to get the services they deserve. So I want to say to each and every last one of you that as we get into this point, I want to tell you that we definitely have to do better, not just as a community, but also as a civilization and as a people as a whole. Because if we're not doing what we're supposed to do and protect the rights of people that deserve service and care in what we call the freest nation in the world, the richest nation in the world, but we still have situations where we've got people that are not getting their due diligence and services that they deserve. I'm going to close with this monologue. And with this monologue, I want each of you to make sure that you're not only listening to this, but I want you guys to please go to the YouTube channel, Changing Trends and Times, and subscribe to this channel. Because every Saturday, we have not just these kind of stories in these series, but we have people that are here that's being more informative and giving you these real lived situations that each and every last one of you are more than sure it touches some part of you, somebody you know, or your family. So as I close, I want to close with we came, we named it, we built the blueprint, now we act. We started this series with a broken promise. We named the history, the centuries of exclusion, exploitation, and deliberate neglect that shaped the healthcare landscape that underserved communities navigate today. We sat with the pain, the mental health crises that goes unnamed, the maternal mortality statistics that should shake a nation awake, the chronic disease burden carried disproportionately by people who were never given the resources to prevent it. We mapped the walls, the insurance gaps, the geographic deserts, the implicit bias in clinical rooms, the poverty that turns a manageable diagnosis into a death sentence. We did not look away from any of it. And today, in this final hour, we drew the blueprint. If you watched all 4 parts of this series, you're not the same person you were when we started. You know more, you feel more, and feeling genuine, grounded, informed feeling is the beginning of doing. That is not a platitude. It is how every single solution we discussed in this episode was born. Someone felt the weight of what was wrong and then did something about it. The through line of this entire series, from the Freedmen's Bureau Hospital, Howard and Meharry, from Dr. Daniel Hale Williams to the FQHC opening its doors in rural counties that a private health system will never serve, is this. Every solution that actually works was built by someone who refused to wait. Every community health worker who sits in a living room with a family that has never trusted a doctor was trained by someone who understood that trust is the medicine. Every Medicaid expansion victory that happened through a ballot initiative was won by voters who took power into their own hands, and then power was refused to them through the front door. We are their heirs, and we have work to do. To the community watching this, you're not powerless. You're not constituent. You are the constituency that every one of these policy fights depends on. Show up, organize, vote, Demand that your state legislator tell you to your face why Medicaid expansion is not on the agenda. Connect with the organizations in our resource guide. Share this series with someone who needs to see it. You're not a bystander in this story. You are the main character. To healthcare professionals, you choose this field. Bring that choice to communities that need you. Mentor the next generation of Black and brown physicians. Examine your own implicit biases. The research says that they are there. Be part of the solution in the exam room, not just at the conference. To elected officials, the voters who put you in office are dying at rates that are documented, measurable, and preventable. You have the tools, use them. Expand Medicaid, fund FQHCs, invest in the medical workforce pipeline. Health equity is not a niche issue. It is a defining measure of whether this country means what it says about the value of every human life. To the private sector, invest where it matters, not as a charity, as recognition that the communities you have too long underserved are the communities whose health, prosperity, and participation your businesses depend on. And to everyone who watched this series, from Lithia Springs to Los Angeles, from Chicago to rural Mississippi, from the clinic waiting rooms to the boardrooms, thank you. This series was built for you. It was built because of you, and it was built because Charles Zachary King believes without reservation that telling hard truths is an act of love, and that love, translated into action, is the only thing that has ever changed the world. Health is not a privilege. It is the prerequisite for everything else we fight for. Without it, there is no justice, no wealth, no family, no future. So we fight for it, we build for it, we vote for it, we demand it. This has been Changing Trends and Times. The trends are changing because we are refusing to accept the times. I'm Charles Zachary King. Thank you for watching. Now go do something with what you know. You all have a great afternoon, a great weekend. We will see you next Saturday on Changing Trends and Times.